Hello everyone, this is Dr. Rukmani Choudhary and you're watching Dr. Rukmani's Health Update. My today's topic is Meniere disease. This is a disease of internal ear, inner ear. So we'll talk about everything on Meniere disease. What are the Meniere disease symptoms? What are the causes when you have these symptoms? Diagnostic criteria, management at home, allopathic mode of treatment, surgical, best effective homeopathy medicine. So you are requested to watch complete video for complete information. If you want individual video voice consultation, you can even drop message on given below WhatsApp number. So let's begin. What is Meniere disease? Meniere disease. So this is a kind of internal ear problem in which internal ear means your cochlea is known for its balancing property. So inner ear function is basically for hearing and for balancing. So once your cochlea that has fluid accumulation, means there is a water accumulation, fluid accumulation. So you have hearing problem, you have tinnitus, abnormal sound, ringing sound in your ear, and you have balance problem. So these are the cardinal, these are the main features of Meniere disease, and this is usually chronic, but you can manage it once you follow the dietary changes. And usually this is unilateral, means one ear is affected. Usually it is seen that this is unilateral, one ear is affected. What are the causes behind Meniere disease? There is no exact and direct cause for Meniere disease. There are supposed believed theories, scientists believed theories. One of these, like having excess fluid accumulation in your inner ear. So this is one of the theory, that you have fluid accumulation in your inner ear, and the others are having allergies, or these can be the part of autoimmune disorder, and at times it is believed that this is like genetic one. The sign-symptoms part. What sign-symptoms you have with Meniere disease? As the inner ear is known for its balancing purpose, so you have problem in balance. So there is a balance issues, and you have vertigo. There's a spinning of head, as if head is spinning in a circle. There is dizziness. At times there is nausea and vomiting, and oral fullness is seen. Means you feel that your ear is blocked. There is a fullness you feel, and hearing difficulties. Obviously abnormal sound, tinnitus, and headache, and heaviness over the eyes. Then see, this is a disease that has remissions, means you don't have symptoms, and this has periodical episodes, means you have at time you have severe attacks, and then there is a remission, you don't have any symptom for years even, and again you have. So these are attacks and episodes for Meniere disease, like periodically episodes and periodically attacks. What about the diagnosis part? How we diagnose Meniere disease, how we rule out that you are having other problems, other associated symptoms, and there are differential diagnosis. Test is done, ear headphones are put, and there different volume and different pitches sounds are there for accessing your hearing abilities. Test, and the other is balancing test. So balancing test is again done. The electrodes are put over your eyes, and through your like cold or warm water pushed through your ears for balancing, for noting down that the balance property of your inner ear. These are the tests, like hearing test and balancing test. And balancing test is also called, like, it is electronystagmography. So this is done for your checking if you have reduced balancing property. About the treatment in allopathy. Treatment in allopathy, it's like, see, you have symptom of nausea, vomiting, and there is a vertigo. So these are the symptom similar with motion sickness. So you are given that kind of medicines in allopathy, like you are given antiemetics in these kind of cases. And as it is believed that this is a collection of fluid in your inner ear, in your cochlea, so for reducing that fluid, you are diuretics. So these are the line of treatment in allopathy. And at times surgeries are the advanced procedure, and these are done only in rare to rare cases where there is a severe attack. Periodically there is an attack, and that is severe, and the patients, they are not responding with the basic line of treatment. So obviously surgeries done in these kind of cases, and this is like endolymph sac procedure. So that endolymph sac procedure, what does it do? It reduces your fluid production. So it reduces fluid production and improves your fluid drainage. So obviously the fluid is reduced, and hearing aid is given, and vestibular rehabilitation exercises are physical therapies. Vestibular rehabilitation exercises are suggested mode of treatment in allopathy. What about dietary part? You are asked to reduce your salt intake, caffeine intake, and just avoid smoking. Just limit your smoking, avoid alcohol even. So these are certain dietary changes. Style changes. Yes, once you have vertigo attack, so just have rest. Yes, just have your anxiety or stress level managed. And once you see any kind of symptom, just see your doctor right away. Don't delay your treatment. So homeopathy and homeopathic medication. You're not supposed to buy all the medicines. These are like with the case. Every case is different in homeopathy. You may have problem in left ear, you may have problem in right ear, you may have decreased hearing, you may have tinnitus more. So your symptoms matter a lot in homeopathy. We consider your symptom, we collect all your symptoms. This is like holistic approach and individual approach. Which side is affected, what are about your case, what is peculiar about your case. Discussing couple of medicine, but these are not the limited one. There can be other medicine as well once you discuss your case individually. Selenium salve is the medicine that is given in homeopathy once you have periodically attacked, as it's a symptom of Meniere disease that you have periodically attacked. There are attacks in episode and there are remissions, means you don't have any problem. Tinnitus and hearing problem, sudden attack. So there is a sudden attack, there is a hearing problem, tinnitus is there, and particularly for the left side. So Selenium salve is given. You may have different form, you may have different color. Just go with the medicine name. This is Selenium salve. In 30 potency, start with the lower one. And these are for the oral purpose, not for the ear drop purpose. No. Oral. So 1 or 2 drops direct on tongue orally 2 or 3 times in a day before. And if you're watching on YouTube, you may find all medicines link in description box below. Gelsemium in homeopathy covers like dizziness, dullness and drowsiness. So dizziness, as it's a symptom of Meniere disease. So you have dizziness, you have heaviness over your eyes. So these are the symptoms covered with the Gelsemium. Cocculus in homeopathy is given in motion sickness cases or travel sickness we say. So you have nausea, vomiting, there is vertigo. So these are the symptoms covered with Cocculus indicus. So you can use this medicine. Cornea mag tops the chart in vertigo cases. Head is spinning in a circle. So if these kind of the symptoms, you can take cornea. Kali Mur, almost specific in Meniere disease. Why? Because as it is believed that there is a fluid accumulation, and Kali Mur is known the best remedy for inner ear, for internal ear, and this reduces internal ear swelling. This reduces the swelling, and this reduces the production of that fluid. So this gives you relief. Specific, almost specific in Meniere disease cases, but oral form drops direct on tongue orally. And even you feel the blocking of the ear, the heaviness in the ear also come in the tablet form. You can even take this form of the medicine, Selenium salve. This is in the bigger tablet form, so just take 1 or 2 tablets 2 or 3 times before having your meal. Dr.RUkmani German homeopathy medicine. I even uploaded separate video on this medicine. This is like given in again travel sickness, vertigo, nausea, vomiting, these kind of symptoms. So this is in the liquid fluid form. So just have 5, 10, 15 drops in some lukewarm water 2 or 3 times in a day before having your meal. This video can give you some amount of help. If you find this video knowledgeable, informative, please like, share and subscribe my channel for further notification. Thank you for your time. Thank you for watching. Keep supporting. Thank you so much.